Welcome to Onslow County Today. I'm your host, Lisa Whitman-Grice, and we are so pleased today to be coming to you from the chambers of the Onslow County Board of Commissioners. April is National County Government Month, and it recognizes the work of dedicated county employees who work each and every day on behalf of our citizens. We're going to be talking to some of those folks today. We'll be visiting with Matt Mano from the Onslow County Health Department, Carson Custy, also from the Health Department. We'll also talk with Billy Robinson and Courtney Hurt from the Onslow County Department of Social Services. We'll visit with Stephanie Kane from Onslow County Community Paramedics Program. We'll also talk with Tori Parks from our public libraries. And finally, Marie Swanifus, who will talk with us about the upcoming opening of our farmers market. You know, when we think about County Government Month, we think about how all of these folks work together to move our county forward, and we are grateful for their service. Welcome back to Onslow County Today, and joining us now is Matt Mano with the Onslow County Health Department. Matt, thanks for coming back.
It's always a pleasure.
Now, April is a really special time. I mean, there's so many recognitions, so many proclamations, and the Health Department is no different. You all have a very special commemoration coming up just as we kick off the month. Tell me about it.
So, of course, we're always celebrating lab techs, administration, nurses. We have specific weeks for everybody. We have national days for everybody. But April 1st to the 7th, we get to celebrate public health as a whole. So we have National Public Health Week on April 1st to the 7th. And, of course, we love celebrating all year round. But this is the time whenever we get to put the banners up. We get to let the clients know, hey, thank a nurse. Tell them thanks for being here. Thanks for serving us. We'll be able to highlight all of our different divisions and the services that they provide to the community. It's one of those things where you don't quite realize how much public health touches and everything that we offer to make sure that our county is protected and safe.
So, Matt, you know, we think about healthcare in general, and we think about those broad strokes: hospital healthcare providers, pharmacists. I mean, all of those people who help us in our time of need, illness, sickness. But public health has a very particular role in our community and connection to community. I'd love for you to talk about what it means to be in public health.
Absolutely. So, of course, we have that healthcare setting. You know, we offer clinical services, and we have different clinics within our clinic at the health department. And so, although we don't offer sick clinics, we don't offer primary care, we're still doing those. We have a child health and immunization clinic where we're making sure that we're getting those vaccinations out. We're doing those annual well child checks, making sure that we get our school assessments done for kids that need it and those required vaccinations for schools. We have our communicable disease clinic that's doing STD testing, making sure that, of course, if we have any communicable disease outbreaks or anything, that we're tracking that and making sure that stuff's not getting spread further than what it needs to be. We also have our maternal health, women's health clinic. So there's a myriad of services within our clinic that we offer on that healthcare side. But then we also have the side where, again, like you said, we're in the community. We have a community relations team that has health educators that's out there promoting preventative health and preventative chronic disease, working with diabetes prevention programs, Healthy for Life, making sure that our community knows what things they should eat, what things they shouldn't eat, how they can promote healthier lifestyles, vaping prevention, all of these different programs that we want to essentially teach people. That way they're not getting to the doctors before it's too late to prevent something. And then in addition to that, we also have other programs like our care management program for at-risk children and high-risk pregnancies. So we're making sure that our social workers and registered nurses within those programs are connecting our families with the providers that they need to make sure that they're getting their dental care and making sure that they're getting the referrals for vision and making sure that they're lining them up to have a care plan that their children are going to need to succeed in their health journey. Same thing with high-risk pregnancies, making sure that our mothers that are at high risk have a care plan throughout their maternal journey to make sure that they're having children and they're delivering babies that are happy, healthy. And so our care management program handles some of that stuff. We have our nutrition services, which really handles the big part of that is our WIC program, Women, Infant, and Children. And so they're promoting breastfeeding classes, they're promoting nutrition for kids, they're offering those nutritional assistance that kind of provides your extra milk and whole wheat breads and healthier vegetables and fruits for your kids to kind of supplement to make sure that they're getting healthy foods. So there's a lot that we're offering. I have some more too.
Well, you know, I think about this big umbrella that you all have, and when you go into your building, it's just a busy, hustly, bustly place.
Absolutely.
But what I'm thinking also about is your grander vision or your grander mission, which is you are as a public health facility, when you're providing education, when you're providing preventative care, taking those early steps, it's about the individual, but it's about the village.
Absolutely.
It's about the community as a whole. Speak to how each of those individual tasks that you do make for a better, healthier community at large.
Yes. So we have a lot of programs that we do at the health department, and you think about it, there's a term that we use called population health. So we think about the group's health, right? The whole county, the county as a whole. And every 3 years, we're getting ready to kick off our community health needs assessment. And so we partner with Onslow Memorial Hospital, and with that, we survey all the community. Surveys are going to be beginning mid-April. They'll be going through May. And we really want the community to hear what are the health priorities of the community. And we line all of that feedback. We do focus groups through that community health needs assessment. And then we also gather all of this secondary data. So we're looking at census data, we're looking at health rankings, we're looking at different dashboards from the state health department. So we're gathering all of this stuff up to really see what is the population health look like for Onslow County. And then through that kind of drives some of those programs that we do. And so with those programs, of course, we're touching individuals, we're doing some individual education, we're doing group presentations, but the goal of those programs really are to better the indicators and results for Onslow County as a whole.
And so when you do that, and you say every 3 years, you also do this as sort of there are some intermittent reports that come out as well to kind of guide you all as you move forward. When you think about, and I know you're prepping for your forthcoming community health assessment, when you look back at 2020, 2021, and where we've gone, what were some of the early indicators? What were you seeing 3 years ago? And what are some of the measures that you're seeing? Where are some changes? And where do you see we need to work even harder?
Yeah. So we're currently working on 4 different community health improvement plans, which came out of our 2021 needs assessment. And so through that one, we've identified, of course, we have a healthy living. I mean, chronic disease is always an issue, diabetes, nutrition and wellness, physical activity, obesity. Those are kind of the things that we've found out of that one, along with your mental and behavioral health, substance use. And so those are some programs that we've been working on, like I mentioned, with diabetes prevention programming, Healthy for Life, for that healthy living part of it, doing our overdose fatality review board to see how we can identify different types of interventions before people using drugs are overdosing and dying. And so those are some of the programs that we've been working throughout the last 3 years, along with about 10 others.
Right.
So we have quite a bit of programs going on, and it's all available on our website to view. But through those, then we start to look at, again, what will 2024 bring? And we know that some things are probably going to be ongoing. Some of those programs we're going to keep going, but we're also going to probably have a couple new community health improvement plans for this next cycle that we'll be working on. We believe mental health is extremely important. I'm sure something will be coming out of the community health needs assessment showing that priority. And again, that chronic disease prevention, making sure that people are trying to incorporate active living and healthy lifestyles into their lives to try and prevent things like high blood pressure, your diabetes, all those things that are kind of going to kind of lead you to bigger health issues.
Right. It's a cumulative.
Right.
It's really cumulative. As a community member, how can we engage with you and participate in the assessment? One, how can we participate in the assessment? Just sharing our information with you. And then I want to talk with you a little bit more about how then can we make the most of your services?
Absolutely. So whenever we kick off the community health needs assessment, we've had meetings from it starting back in January and February. And so we have subcommittees that are kind of planning it. The biggest thing that we want from our Onslow County community are whenever we start our community health assessment surveys. So we need community feedback so that we know what are the health priorities of the community. What does our individual community see as needs for them? It's going to have a variety of questions for them to answer. And so the survey won't take too long, but it's also in depth because we need to know that information.
Right.
And so we'll be gathering that, and it'll kind of help us identify the health needs and the priorities for those community health improvement plans. So without feedback from the community, we don't know the individual responses and feedback from Onslow County. So we'll be starting those surveys mid-April, like I said. They'll run through May. We'll be providing the links for it on social media. You'll probably see some flyers, billboards around town to promote that. So there will be plenty of opportunities for people to see it, to share it, and again, make sure that all of our Onslow County community is represented in that. So we want to make sure that we have everybody from every corner of the county and every population that they're able to provide their input and feedback.
And as you say, it's about the population, right? So by us engaging with you, letting you know what the conditions are within our community, you all can better respond, create programs, and then we can go to you and you're going to help us live a better, healthier lifestyle, which ultimately, again, comes back to the services you provide.
Exactly. And like I said, there's some programs that we're always going to do. They're always there. We always offer them, our outreach presentations, stuff like that. But once we get this feedback and once we get this community health needs assessment built out for 2024, it'll really help us to target some of those programs that we need to do that we might not specifically do already.
And you're going to kick all this off again on April the 1st with the National Public Health Month.
Yes.
And you're going to be doing within that, again, some spotlighting. How can we see what you're spotlighting? How's the best way for us to engage and learn more just in general about what you all do?
Absolutely. So on social media, you'll see us posting every day, highlighting a different division. And I cannot forget about environmental health.
No.
So if you go over to 612 College Street where the health department is, you won't see environmental health there. And that's because they're located in the government center. So it's just a little easier there because whenever the public is going to get specific inspections or going to get services done by environmental health, there's also some permitting that's required by that. And we want our citizens to have kind of like a one-stop shop. We don't want them to have to go across town. So
sure.
Permitting is also in the government center. So it's a little easier for them, but that's not to say they're still a part of us, right?
Right.
And so whenever you walk into a restaurant and you see what's the grade, that's environmental health that's going through and making sure that these restaurants are providing tip-top service and making sure that they're cooking their raw meats, vegetables at the correct temperatures, making sure that stuff is stored correctly, making sure that the facilities are clean. But they don't just do restaurants either. They're also looking at public swimming pools, daycare centers, lodging facilities. So they are all over the county making sure that all these facilities that you either have your children in or you're staying in overnight, swimming pools that you're swimming in, they're making sure that they are adequate, that they are perfect for you to be able to go into to prevent, disease, bacteria, sickness, anything like that.
That broad scope that the public may not realize, all of that is coming via the Onslow County Health Department.
Yes.
With a key mission and goal of keeping our community healthy and safe. If you wanted to share that message in a nutshell during National Public Health Week, what are you going to tell them?
We are everywhere. I mean, public health is everywhere. And that's one of the greatest things about us is sometimes you don't realize all the different things and all the different ways that public health touches you or impacts you. But and a lot of people, I think, became more aware during COVID from public health, of course. But again, that kind of hits on the vaccination side of it and the clinical side of it. But going back to, we have all these other things like environmental health, like the outreaches that we do, promoting the programs and stuff. So one thing that I want to say, National Public Health Week, we are all over the place. We offer a ton of different services, and we're doing a lot of stuff behind the scenes that you might not notice, but it's still impacting.
And we are all grateful and better for it.
Absolutely.
We are grateful for all of your team members, from your clinical staff to your public information team that you've got, to those incredible team of just call handlers who are making appointments and making sure that all the paperwork, which is mountainous.
Yes, they were busy all the time.
All the time. So during National Public Health Week, let us make the public aware of what you do, but also let us say thank you to you all for what you do.
Thank you.
Matt, it is always a joy to have you, and we look forward to your next visit.
Me too.
Welcome back to Onslow County Today, and we're going to continue on with our conversation about the services that are provided with our Onslow County Health Department. Joining us now is Carson Custy. Carson, welcome back.
Good to be here. Thank you for having me.
Carson, we're going to talk very specifically about an awareness program that you all have at the Health Department, because as we said earlier when we were speaking with Matt Mano about Public Health Week, you also are here to talk about a particular week of recognition and awareness.
Right.
Tell me a little bit about it.
So April 14th through the 20th is National STI Awareness Week. So I definitely want to highlight some of the services that we provide at the Health Department, and want to get the word out to the community so that way they know we're available and willing to help.
And the language has changed a little bit through the years. We oftentimes referenced sexually transmitted diseases. You're using the acronym STI now.
That's correct.
For
sexually transmitted infection. Yes, ma'am.
Okay.
Yep.
When we talk about that, those are, again, sort of a broad scope of awareness that we want to be talking about today. We should, of course, remind our audience that this is a little bit of a mature conversation we're going to have.
Absolutely, yep.
So as we're having this conversation, just want to make sure that everyone is aware of that as well.
Sure.
Go ahead.
So what's important to know about this, to kind of put things into perspective, on a national standpoint, around 20 million cases of STIs are reported, and that puts a pretty heavy burden on the healthcare system. So around a $16 billion worth of costs associated with these infections. So it's prevalent for sure, and as ubiquitous as sex is in media, pop culture, music, things like that, what's not typically associated with it is some of the risks involved with it. So, I definitely want to make sure that we let the community know that we want you to be screened. And knowledge is power, so knowing where you stand is very important, and being able to have those conversations with different partners is extremely important. So.
In the 80s and 90s, as the world faced the HIV and AIDS crisis, we had a lot of conversation. And then, I think sometimes, I don't want to use the word complacent. I want to use the word that, we know that. We've had these conversations. But there are new generations coming forward, and so it's really important to be talking, especially with young people. What is the sort of the emphasis when we're talking about young adults, especially? Right.
So education is really important when it comes to these kind of situations, especially with our younger folks. Just to give an example, there may be some sense of security with our younger folks that are on birth control, but what's important to remember is that being on birth control does not preclude you from contracting STIs. So it's really important to practice safe sex and to wear protection during those situations. So to kind of gear towards our young folks, make sure that if you're sexually active, definitely get screened so that way you know where you stand and can be safe.
One of the things that the health department is so good about doing is education. And we talk about preventative health care. You are a resource where people can have screenings and can get tested. Talk a little bit about that process.
Right. So in regards to the education that we can share with our clients, we have access to great resources on a federal level, a state level, and we have excellent staff that work at the Onslow County Health Department that are able to reach specific people with specific situations and definitely get them get them taken care of. We're able to walk people through what can be an embarrassing and a vulnerable situation and make sure that they come out of it on the good side of things and haven't been taken care of. Yeah.
And not just embarrassing and that vulnerability that you have to, to go in, and which takes a lot of bravery, but it's also really potentially very scary.
Oh, absolutely, yeah. So some of these infections, we're able to treat, but there is also, I don't mean to have a scare factor here, but some of these things that you can contract do have lifelong impacts. And while we are able to provide treatment for certain bacterial infections at the health department, if there are viral illnesses, we do not have the capacity to do that, to treat those kind of things at the health department, but we have partnered with some of our community partners in our surrounding area to get these individuals set up with quality, competent care, so that way these illnesses can be taken care of as well.
I think that, oftentimes in the moment, we don't think about these lifelong consequences, and you want people to be prepared prior to those situations. When you all talk with them, talk about the level of compassion and understanding your team brings to that as well. Right.
So we are here to serve the public, and we want to make sure that we are providing safe and confidential services to these clients. We have an understanding that is our specialty, and we welcome anyone that is willing to come and get screened. So we will serve you with open arms and make sure that you're taken care of as best as possible.
And then in terms of a community health impact, when we have a healthier community, that impacts our entire village.
That's right, yeah. So we have a very young population in Onslow County. So we want to make sure that we're getting the word out and people are coming to see us.
Well, Carson, I thank you for bringing this information to us, for making sure that people are being the healthiest and making the best choices that they can make. Absolutely. If people want to know more, all this information available on your website, best way to find out?
Right. So you can simply do a Google search for the Onslow County Health Department. When you bring up that homepage, you can scroll down a little bit, and there's actually a link to the STI clinic. It will have contact information there, as well as a little bit more in-depth information on the services that we provide. But if you choose to do so, you can always give us a call. Our telephone number is 910-347-2154, and we'll be glad to get you scheduled for an appointment. And if I may add, majority of the services that we provide are free of charge. So we don't want any kind of financial barriers to prevent anyone from coming to see us.
Thank you so much for sharing that, Carson.
Yes, ma'am.
I think that is vital to the health and well-being of our community, and I thank you every day for what you and your team do.
Yes, ma'am. Thank you for having me.
Welcome back to Onslow County Today, and joining us now is Billy Robinson with the Onslow Department of Social Services. Billy, we're so glad you're here.
Yep, glad to be here.
So we want to speak about safe sleep practices with our babies. Off camera, we were saying, being a parent's hard.
Yes.
And as much as, and there are plenty of how to be a mama, how to be a parent, a daddy, a caregiver, but each and every one of those little people is very different. And sometimes the guidance and the advice that we get changes over time. And we're here to provide some updates and some current information about the best way to help our little ones sleep and to sleep safely. And as a parent of young adults, sometimes the hardest part when they're little is, I just need you to sleep, right? If you can sleep a little bit, I'll sleep a little bit. That is in those first 6 months,
Yes.
8 months, that's the real challenge. And you want to make sure that that baby is as safe as possible. Talk with us, please, about safe sleep.
So safe sleep, those practices should always be practiced always through the first year of life. The first 6 months are very critical. 90% of all sleep-related fatalities happen within the first 6 months. So things that and then here in North Carolina, we have over 100 children, infants that die each year from unsafe sleep conditions. Just in 22, we lost 77 from co-sleeping. And then the other 37 for unsafe sleep environments like car seats, cribs with toys, blankets, and things of that nature in their cribs. So I know people don't I like to lay the baby on the stomach, puking, spitting up and things of that nature. That's not true. So I always want to lay the baby first and foremost on their back for their naps and at nighttime. And then as far as their concerns about their spitting up, a baby's anatomy and gag reflex is going to keep them from choking on that. So, and then laying them on the stomach, airway. There are more increase of breathing in their own air. What is that going to do? Cut down the oxygen and more risk of suffocation.
Well, let's think about it. We've got this new little person, and when you are getting ready to have a baby, you're given 1,000 blankets, you're given 1,000 teddy bears,
Yes.
You're given cute little pillows, and oh my goodness, that crib looks so cute. And those things we all need to, first and foremost,
Yes.
first thing before we get home from the hospital, take that picture of that cutie crib and then take it all out, right?
Yes, that crib should be nothing. If you're using a crib, it should be a firm crib. And if you got an older crib that's been done, just make sure it was manufactured after June the 28th of 2011. All those cribs fall under the new safety guidelines.
So 2011 is we want those new cribs.
Yes.
Okay, we want that firm mattress and a fitted sheet only.
Yep. And then the next question comes in, well, my baby's going to be cold. A onesie with a wearable blanket. That way, if the baby starts turning, they don't get tossed into the covers or fall into the edge with the crib bumper there and suffocate.
Okay, and what about, so, when they're brand new, we're oftentimes advised swaddling gives them that comfort level, but swaddling is not a long-term practice that you recommend.
So swaddling is not real tight because you don't want to restrict their airway. Just like think about yourself, you swaddle yourself too tight, you can't breathe. Same thing for that baby.
Okay.
But when they start to roll, that's when we want to leave that swaddling when they're starting to roll over.
And just because the book says 2 months they roll or 3 months they roll at 6 weeks. You're watching them.
Exactly. Every baby's different. Some roll really early, some roll later. So and that's the thing we're worried about. Because when they first start rolling, they'll roll over, but they can't get back over.
Right.
And that increases that risk of that unsafe sleep environment and death.
Okay, so first we prep our sleeping space so it's just right. We don't worry about that blanket because they make these great onesies, very cozy, keep the room slightly warmer. Then, that'll make a difference as well. So we're not worried about that. What had been a very traditional practice in many households is the idea of a family bed or co-sleeping. And we want to make sure that people understand that we've also changed our thoughts about those.
Yeah. So the baby should sleep in that separate sleep area in the room with you for at least the first 6 months. Don't want the baby sleeping with you in the bed because think about it, you've got all those nice covers, those blankets, and you're cuddled up with the baby. You fall asleep, that baby rolls, or you roll over, or if you got a younger child, maybe a 2-year-old, 3-year-old that's been used to sleeping with you, they're not used to that new baby. They come and jump in bed, and they push that baby out of the way, and the baby gets in the cushions, and then lo and behold, we have a tragedy. And we've had a recent one similar to that.
So again, that independent sleeping in the room so that we can listen in and monitor and check on our little one, but that they are independent on their own in that space. We're sleeping in our space with all of our covers and our throws.
Yep.
But we also, many folks are such deep sleepers, they may not even realize. Right?
Exactly.
Now, there are also other precautions we need to make as we also prepare ourselves for sleep, and that's the avoidance of anything like drugs and alcohol that might suppress or that might make us sleep even more deeply.
Exactly.
Right?
Yeah, so just be aware of any medications that you may take, because there is a lot of our infants that do die from fatalities. There is a high percentage of there's some type of medication or illegal drugs that are involved. So just be mindful of that. If you do take them, make sure your partner, your husband, boyfriend, your mother, whoever else is helping you with that baby, help keep an eye on that baby.
Finally, I want you to talk about a little bit about the statistics, because we have seen an improvement here in Onslow County just in the last couple of years. The numbers, while they may fluctuate with this information, we're saving lives.
Yep. So in 2021, we had 5 here infant fatalities due to an unsafe sleep environment in Onslow County. Last year, we only had 2. So we have dropped that big time. And statewide is also dropped also.
So very, very sad, but an opportunity to always help families and guide them.
The big important thing with these unsafe sleep environments, they're preventable. Just from 2016 to 20, I think it was 900 and some, no, that's national, sorry, 600 and some infants died from co-sleeping or unsafe sleep environment, and all of those were preventable just following some simple guidelines.
So what we do is always, always, always carry that knowledge forward to this next generation of parents.
Yep. And we don't expect parents to remember everything, so we have tons of resources. You can come to the county website and just type in, simply Google Onslow County Safe Sleep. It's automatically going to pop up safe recommendations. Or you can go to safesleepnc.org, and all those recommendations are there also.
Well, the idea is that we're making this a safer, better community for our families, for our children. And the information you've brought with us today is so valuable, Billy. We are so grateful to you for that. If you had one final message for parents or parents-to-be, what would it be about the importance of safe sleep?
Be 2 things for one. First is that baby is our future. So do those simple, small things to protect your baby. And then the other things, well, I might not have the money to buy a crib or something like that. We have so many community partners and resources. You can simply come to the Consolidated Human Services, where the health department and DSS is at, ask to speak to someone about getting help with safe sleep, and we're going to get you some safe sleep for that baby, whether it's a crib, whether it's a bassinet, or a pack and play for that baby. So there's resources there. So
thank you, Billy, so much for what you do and for what you do for our community. We appreciate it.
Absolutely. Glad to be here.
Welcome back to Onslow County Today, and joining us is a new guest to Onslow County Today, Courtney Hurt from the Onslow County Department of Social Services. Courtney, thanks for being here today.
You're very welcome. It's a pleasure to be here with you today.
You are wearing your beautiful blue.
Yes, ma'am.
Because April is a very special time at our Department of Social Services, specifically our CPS division.
Yes, ma'am.
Because it is what?
It is Child Abuse Prevention Month.
Now, when we talk about that, we're talking about education.
Yes, ma'am.
We're talking about community engagement.
Yes, ma'am.
And we're talking about how we as a community all come together for our children. Talk a little bit about what this means at Onslow County DSS and the efforts that you all will be making this next month, this whole month of April, to share that message.
Yes, ma'am. So if you guys actually come down to the health department, you guys will be seeing, starting April 1st, a bunch of blue and silver pinwheels. So that is a symbolized material for Child Abuse Prevention Month. So, we like to have those outside of our community. We encourage the community to put those outside of your homes, schools, health departments, hospitals, anything like that, to show your support for Child Abuse Prevention Month. So other things that we like to do is we like to provide parenting education to our families. We like to provide mental health services, substance abuse services, anything like that to our parents to help them prevent child abuse or neglect with their children.
Let's back up just a little bit. When we think about child abuse prevention.
Yes, ma'am.
And we think about what it is to be a parent in, the 21st century, in 2024, and the challenges that we face every day, and we have this new life come into our home.
Yes, ma'am.
It's hard, Courtney.
Yes.
Being a parent it should be, or we're told, It's completely natural. You'll just know, your instincts will kick in.
Yes, there's no handbook to parenting. So we see a lot with our families, a lot of stressors that we see with the families that they deal with, like loss of jobs, low education, like drop out of high school, or even like middle school. Like we have parents that doesn't have an education, a high school diploma. The employment that we're facing, substance abuse, we're facing mental health issues and things like that. So basically we just try to talk to our parents about how to prevent child abuse, especially with our babies are crying too much when you're a new parent. And sometimes baby have colic, or sometimes your baby just cries and you don't know why. Obviously babies can't communicate verbally, they can only communicate by crying. So we try to teach our parents that when your baby's crying, you're overwhelmed and stressed out, put your baby in a safe place like a pack and play or the crib or bassinet, and walk away and give yourself a couple minutes to cool down. In those instances, it's okay to be selfish, to take that time to yourself so you can come back and be a nurturing parent to your child.
And, you know, oftentimes, sadly, we see these cycles. So maybe if you weren't parented in the way that was best for you, you might not even have that sort of example or model for what to do as you become a parent.
Yes, ma'am.
Right? So we've not perhaps even had that that experience ourselves.
Yes, ma'am.
Talk about the value in parenting education to help break those cycles.
So when I work with my families, actually, one thing that I like to do is I like to tell my parents, hey, I understand we're asking you to complete parenting education, or I'm coming to the home to provide that one-on-one education. I never want to make my families feel like they're being a bad parent. No. So I tell them, look, everybody needs a parenting class. Everybody can have an additional parenting techniques and skills to add to your toolbox. And so I like to express that to my families and let them understand that, hey, we all need that help. It's okay to ask for help. We don't have the handbook to parenting, like I said earlier. There's things that we don't even know about when it comes to techniques, when it comes to parenting on certain circumstances. And I understand generational curses need to be broken. I know that we were raised a specific way. This generation now is completely different, and it's okay to switch up your parenting and add different things to that parenting toolkit that can help you have a more nurturing relationship with your children. So I like to talk to my families more in depth, like, hey, listen, let's sit down together. Let's do this together. You can teach me some new things. I can teach you some new things. So parenting is just overall hectic and stressed out, but you will enjoy it once you get down and dirty and talk about those uncomfortable conversations. And sometimes those conversations need to be had. And I like to express to them, it's okay to ask for help, because everybody needs a little help every once in a while. And don't be ashamed to ask for help.
Absolutely. You know, when I think about our families here in Onslow County, many of our families are from all over the country, if not the world.
Yes, ma'am.
And they don't have that extended family right here.
Yes, ma'am.
To give them oftentimes the support.
Yes, ma'am.
If you're in a community for a long time, you may have family, you may have friends, you might have that built-in safety net. And when you're new to a place and you don't know anybody, and then you become a parent, that's one of those additional stressors. You all really can serve as that support system, as that village.
Yes, we actually work with our military families as well too, you know, so we like to express to our active duty members and family members that, hey, there's resources on base also as well off of base that can help you. Like we have the Family Advocacy Center, which is called FAP. You have the Community Counseling Center on base. You have Stephen Cohan that's open to military families, veterans, active duty, any dependents that you have that verifies for military status. We have Peers Parenting, the Peers Family Development Center that's located here in downtown Jacksonville. We have the YMCA, we have One Place, we have a slew of resources for all of our individuals in our community for help.
And it really does. It takes that community support.
Yes, ma'am. It takes a village.
It takes a village for sure.
Yes, ma'am.
We also have the role of that village is also to be vigilant and to be mindful and watchful. And one of the scary parts of being part of that village is when perhaps we need to say something, when perhaps we've seen something that we need to share with your department.
Yes, ma'am. So if you see something, say something. Everybody in North Carolina is a mandated reporter. We like to express that a lot with our families. It might make you feel uncomfortable and things like that. It might destroy relationships, but the ultimate safety is to prevent child abuse with these children. That is the biggest thing that I express to my families. It's okay to report things that you feel like that are going to put your child in a unsafe position, or other children.
So just, like you said that, but your instincts to trust them,
Yes,
to
ma'am.
know, because ultimately it's the protection of that child.
Yes, ma'am.
What are some things that we're going to look for those pinwheels? We're going to wear our blue, and we're going to wear our blue on a specific day, right?
Yes, that's actually going to be Friday, April the 5th. Is actually Wear Blue Day.
All right, so to show our solidarity
Yes,
in
ma'am.
support of child abuse prevention, what are some other things we might look for coming out of your department, coming through DSS, in terms of information, information sharing, or where can we go to learn more about what you're doing?
Yes, ma'am. So you guys can actually go down to the health department. You can ask for any type of resources that we have in our community. If you do have an open CPS case, your social worker, having those conversations with them. But you don't have to have an open CPS case to have access to these resources. You can go out in the community to like the couple places I mentioned before.
Sure.
You have peers, you have the Family Advocacy Center, you have one place that you can go to, and like I said, the health department, they have like informational resources on there. You can go to onslowcounty.gov, and then they have all of the resources there as well too on our website for social services.
Ultimately, it's about the safety of our children.
Yes, ma'am.
And you obviously, you've been with the county, you told me 5 years now.
Yes, ma'am.
You obviously have a passion for that. When you bring that to work every day, while I imagine your job must be incredibly challenging.
Yes, ma'am.
What motivates you each day?
These children is what motivate me each day. I tell my parents, your kids is like my kids. I'm gonna treat them like that. I'm gonna make sure they're protected and they're safe. And so that's what keeps me going every day, because when I see their smiling little faces and they just smile like, Miss Courtney, it just breaks my heart. And that's just what keeps me going every day.
Well, Courtney, thank you for what you do, for what your team does. And thank you for reminding us that we all play an important part in the prevention of child abuse in Onslow County.
Yes, ma'am. Thank you.
Welcome back to Onslow County Today, and joining us now is Stephanie Kane with the Onslow County Community Paramedics Program. Stephanie, thanks for being here today.
Thanks for having me.
We've not had a chance to visit and talk lately about community paramedics, and I'm so glad you're here.
It's been a while.
To share with the community what you all do, because it is truly a calling. So first we want to talk about is, how is a community paramedic and your task or your mission different from your colleagues who are assigned as paramedics or EMTs in the county? You have a slightly different scope of work.
We do. We have 6 paramedics right now that are community paramedics, and they focus on those higher need patients.
Right.
So the ultimate goal initially when the program was designed was to keep those individuals who didn't need an ambulance that called frequently to get to the source of their need, and keep them off of an ambulance and keep them out of the emergency room and get to the core of the problem.
Right, so oftentimes when we're feeling anxious or really feel we're having a medical emergency, we're gonna dial 911.
Correct.
Right, and someone's gonna come to my home. But you all have discovered through lots of research and the collection of data and conversations amongst yourselves as EMTs and paramedics, that there was a group of the members of the community who needed your services, but in a different way.
In a different way. So they're responsible for essentially case management. They are ALS responders. They're in QRVs, so they can respond to 911 calls. But they keep their ear open for those ones with that address that we're familiar with.
Right.
Or that demographic that might sound familiar, that age, that description of the person. And they'll dispatch themselves to those calls and help to intercept the ambulance, the unit, the crew that's on that unit, to make sure, again, their needs are being met and it's not in the emergency room. Some of those individuals may need mental health services. They may need substance use services. They may need assistance just getting to their primary care. There might be a transportation problem. So we help to mitigate that and reduce those 911 calls.
But you're still there and you're still responding, right? There's no diminishing of that need.
No, not at all.
As a matter of fact, you all have elevated it to a different
Correct.
level. You've said, absolutely, we are here for you, but we don't need to transport you. Let's have a conversation. Let's find out, is it food insecurity?
Correct.
Is it we've not managed our medication properly? You all are there to serve as that intercessor.
Correct. So each patient that is referred to us, we have a referral process, and it can come from EMS, DSS, the Sheriff's Department, Jacksonville Police Department, Fire Department, civilians, citizens of the county. When we receive the referrals for those, we're going to do a needs assessment. So separate from their full medical ALS assessment, we're going to do a needs assessment. And that assessment will cover things like, are they insured? Do they have housing? Do they have adequate housing? Do they have income? Do they have food? We work with several food banks. Sometimes just getting our foot in the door to let these people know that we're there for them is just bringing them a box of food.
You know, I think some of that, in hearing the conversations through the years with your team members, with your colleagues,
Yes, ma'am.
is the sense that isolation that a lot of your patients might feel.
Correct.
And sometimes you're that voice right there for them. You're that moment of solace or comfort. Talk a little bit about that relationship building you all have done.
So one of my favorite patients, clearly I can't state a name.
Sure.
It's an elderly man. It was 2 years ago at Christmas. His wife passed away just before Christmas. He did have a substance use problem, and his choice was alcohol. I met him right before Christmas, and I just asked him, what do you love? And he said, coffee. So what do you like in your coffee? He said, just cream and sugar. I said, okay. Well, I worked Christmas Day, and I went by to check on him. I just took him a cup of coffee. He didn't want anything from us. It lit up his day that he got a cup of coffee.
Oh my gosh.
Continued to refuse services. We are about 4 months now into his full recovery. He is employed in a full-time program, but it took 2 years
Wow.
of just, how you doing? Have a cup of coffee. And sometimes that's what it takes. Some individuals, it's fairly quick and we can get them services in place, but the challenge is getting them to accept our help.
Right.
And I couldn't be more proud of the team we have. They're super motivated. Nothing is off limits. They're great advocates for our citizens.
And it's also, again, that link, that connection that you all are building. You're not in any way taking away from emergency response.
Not a bit.
Because you all have this call, this direction. When I think about you all and my experiences with you all, I also cannot imagine people with more heart for what you do, more sense of calling. Talk about the camaraderie amongst your team and that motivating force within you.
We have our team now is fantastic. Like I said, I couldn't be more proud. Everyone has their own unique set of skills and their own unique way of communicating with each other. They are community partners, our community, and they are just a blast to work with. We currently have 3 peer support specialists. They all came from somewhere different.
Right, right.
And so that they are all bringing their own unique perspective.
And give to the community.
Absolutely,
Now,
absolutely.
As members of the community, we have a responsibility to our neighbors,
Sure.
right? We're also responsible for being there and being supportive. How can we assist you? How can we help make those referrals if we feel like, my neighbor down the street or I've seen and I want to give them what they need? How can we help you?
So we have a referral system now through our page, which is a county government page. So it's Onslow County Community Paramedics. If you just Google that,
Okay.
It comes up as its own search. Scroll about halfway down and there's a QR code. You can scan that with your phone and send the referral, or just above it, there's a little highlighted section that says refer. Click on that, it takes you straight to a form. The first field in there says EMS run number. That is only for EMS. Anyone can refer through that. It's not a mandatory field. Once you send that in, it comes straight to us. So it's real time. That referral page is checked 2 to 3 times a day.
Fantastic.
So we're able to make contact. Our goal is 24-hour contact.
And so we can help you all find that community member in need.
Absolutely.
Because, as you said, there's also some reluctance to ask
Absolutely.
for help, and so we're not here to say, "Oh, poor you."
No.
We're here to say, "Hey, let's make a difference."
Did you know this was available to you? Did you know that these services meet your needs and take pressure off of you?
What about those folks who you've worked with in the past? Those success stories, as you said, you mentioned your favorite patient.
It's
right?
just a memorable,
right.
Yeah.
But now 4 months into recovery, are there other success stories like that your team members share?
Sure. We not only deal with people who fall often or don't have medication problems, sometimes there's domestic situations. Sometimes separating family members and getting them into appropriate facilities actually will build their relationship within their family. So we had a situation like that happened about a year ago. Utilized a ton of resources. Nobody knew whose job it was.
Right.
And bringing everybody to the same table, we were able to get this particular relationship, I don't want to reference too much of it.
Sure, of course.
Separated, and actually is beginning to build that relationship
Build back.
through the whole family.
You know what? You said something that really just struck a chord with me is nobody really knew whose job it was.
Correct.
And sometimes that's just because it's the job of community paramedics, right?
Well, and I think we do a really good job at coordinating other organizations to work together.
Sure. You all are a bridge.
We're a bridge.
You're a bridge.
Absolutely.
And you're filling those gaps and you're filling those needs. I always like to think about the next generation of leadership. And if you were to speak to young people who wanted to choose emergency management, emergency medical services, if they're thinking about that path as a paramedic or an EMT, what would you tell them about being a community paramedic?
It's a long-term job. We do treat acute patients.
Sure.
But our focus in our job is long-term. So we're building relationships with these folks. We don't do the immediate treatment, take them to the hospital and lose touch with them. Our job is to maintain that relationship and build that relationship. So I think, I started as a CNA.
Right.
So the nursing side, you get to see more of that long-term nursing type care than the acute care.
Very good. Well, Stephanie, it is always, for me, just such an honor to talk to you all about what you do and hear about those stories and hear about those moments.
Sure.
And to hear about the camaraderie that you all have forged in your commitment to the community. So beyond anything else, thank you for what you do.
Thank you for having me.
Welcome back to Onslow County Today, and joining us now is Tori Parks with our Onslow County Public Libraries. Tori, thanks for being here.
Thanks for having me.
Spring has sprung.
Yes.
And there's a lot going on at our libraries, as always, a lot of fun things. But you do have a special commemoration coming up this month. Tell us about it.
So between April 7th and 13th, we have National Library Week. And the theme for that this year is Ready, Set, Library.
Ready, Set, Library.
Yes.
Right.
So on April 9th, it's going to be National Library Workers Day. And April 10th is National Library Outreach Day.
We were talking earlier about everyone's sort of job description and how no one does one job. Right? That would be impossible to say my job is. And I can't imagine people who multitask more than our wonderful library workers and librarians at the Onslow County Public Libraries.
Yes.
Talk a little bit about that recognition day. And while we don't want presents, it would be great if you just said, hey, thanks for being here.
Yeah. So we definitely all have a bunch of different tasks that we do. So we not only interact with the patrons, but we shelve the books, we create programs, we do a lot of research to see what people are interested in. So there are a lot of different hats that we wear, but we love all the hats.
All the hats, whether it is Legos or helping with genealogy research, or the other day I caught a librarian with some Nerf guns. So I'm just saying.
You never know what you're going to walk into when you come into the library.
What a great, fun, and rewarding way to spend your day.
Yes.
Now, you also have within that week some other commemorations as well.
So we're going to be focusing a lot this spring on gardening and vegetables and things like that. So we have 2 different programs. One of them will be at the main library, and it's going to be all about vegetable gardening. So how you can get started, what kind of seeds you need, everything that you need, the proper location to put your plants. And then we have another program called Plant This Instead in Swansboro, and that one is all about what kind of plants you can plant that are not invasive or harmful to the landscape. So just talking about how we can better grow things.
You know, I'm not in any way shaming the Bradford pear, but we have all been told through our North Carolina State University and Cooperative Extension and gardening centers, we don't need to plant those anymore.
No, we don't.
Those are one of those troublesome invasive trees that are fragile. They don't stand up well in our environment. So let's learn about the right things to plant.
Exactly.
The right things. Now, I did hear what a great turnout you all had for your composting class last month.
Yes.
So you got us from the very soil that we're going to plant in, and now it's time to put the seeds in that soil.
Yes, and speaking of seeds, we also have a seed library at Main Branch.
Neat.
So you can go in and you can look at all the different kinds of seeds. You can bring your seeds in as long as they're packaged properly. You can trade some in, or you can just come in and pick whatever you like.
Oh my gosh, what a great treasure trove.
Yes.
That is phenomenal to be able to share that and share these beautiful things that grow. I know that all of your branches are gearing up. We're going to visit soon about summer reading coming. It'll be here before we know it. And so just give us a hint. What's the theme this year?
I will stick with one word, and the word is adventure.
Adventure. Well, we are excited about that. You all have your beautiful newsletter for the spring all ready to go and available. How do we learn more about what you all are doing this spring?
So you can find our newsletter on our website, or if you go into the branches, you can find a print copy, or there are also monthly calendars.
Fantastic. Anything else you want to share that's coming up on the horizon, Tori, that you want us to be aware of? What are we looking at?
I would say definitely look out for the signs for summer reading, but also begin to look out for some artwork at the main branch.
Fantastic. It is always a joy. We want to direct people one more time to all your socials and how we know all that's going on.
So our website, our Facebook, and our Instagram.
Fantastic. Tori, thank you for being here. Thank you for bringing some spring
Yes.
to Onslow
Thank you
County
for having
today.
me.
Welcome back to Onslow County Today, and joining us is Marie Swanifus with the Onslow County Farmers Market through our Cooperative Extension Office. Marie, thanks for being here today.
Thank you for the invitation. Glad to join you.
Well, springtime is here. It has been beautiful. We have been getting excited. The days are longer, it's warmer, and it must be time for the farmers market.
That is correct. We've got opening the 2024 season opens April 13th.
Really around the corner, we're here.
Yes.
When you think about the farmers market, you all capture all those moments, right? It's fresh flowers, it's fresh food. Talk about how people look forward to this every year.
So all the wonderful things of spring, local produce, local meats, honey, eggs, all the wonderful things.
You all, I mean, it really is such a lovely representation of those local products. And every year you'll have food vendors as well. You might have food trucks. Sometimes you've had music. Sometimes you've had kiddo crafts. So you're already pondering what this year looks like. We're not going to reveal too much, but there's a lot in the works.
There is a lot in the works, but there is one exciting thing that we are bringing back to the market that we do want to share with the public.
Sure.
In addition to the farmers market nutrition vouchers that WIC and seniors are eligible for, we're also bringing back the SNAP EBT program.
Fantastic, wonderful. So our families can really have access
Absolutely.
to that local and fresh produce.
Yes.
Also, your site is so beautiful, and you've got your wonderful Discovery Garden adjacent there. I understand there was a recent construction project right there in the back with the little pergola.
There is.
How beautiful. And of course, as always, you all work with our master gardeners, our 4-H'ers, and of course, our beekeepers.
Yes.
As a whole, when you think about what Cooperative Extension does for our community, share a little bit about that team that you all have.
Right. So we consist of many different areas: agriculture, row crops, livestock, horticulture, whether it's commercial or residential, 4-H, and we all work together and work to bring science-based information back to the community.
Well, science-based in Onslow County also turns into beautiful things like strawberries and tomatoes and buzzing bees.
And the Discovery Gardens and all the wonderful things.
All the wonderful things that we can look forward to. All right, so we're excited. We're bringing back that SNAP EBT program, certainly the WIC vouchers, and then you all are going to be revealing to us as the spring moves on what's going to come next, and the different programs and activities you'll be hosting every month. But what we want to look forward to most, first and foremost, is Saturday, April 13th.
Yes.
And what are going to be the hours?
It'll be Saturday, 8 to 12.
8 to 12. And we want everybody to know we have a lot of new folks who move into Onslow County. Where are you all located?
So we're located at 4024 Richlands Highway, just around the corner.
From where we are today, right?
Right.
Okay.
And always accepting new vendors and businesses. And we've got the applications available on the Onslow County website.
Fantastic. So if you are that producer of those wonderful tomatoes, reach out.
Absolutely,
right?
yes.
Well, Marie, it is always a pleasure to have you. We want to remind folks, look at your website, contact your office, and be ready to spring forward.
Yes.
Thank you for being here.
Thank you for having me.
Welcome back to Onslow County Today, and we are welcoming back Carter Metcalf from the Onslow County Planning and Development Department, our director there. Carter, before you came on, I saw you go in that direction and then back again. This is a busy season for you because you have spent many, many months working through Horizon 2040, and I want you to explain what that is to our viewers, what it means to our community, and where we're going next. So first and foremost, a little background for folks who might not be aware what your department has been really processing for many, many months now.
Absolutely. So since 2022, we've been working in the process of creating a new comprehensive plan for the county. The goal of the plan is to outline how are we growing, how have we been doing, and where are we going? And so Horizon 2040 works towards that to establish where are we going to be in 2040. So we've been spending months and months, as you've said, compiling all sorts of data. We went out to the community. We did 3 different public engagement sessions in different areas around the county. We're in Sneads Ferry, out by Swansboro, and up in Richlands. And also did an online survey that had hundreds of responses.
Fantastic.
And so we've collected all this information of how the community sees itself and how the community wants to grow. Plus with our data-driven approach of looking at statistics and the history of the county and who we are, all of that together, we've put together a plan. And so we're ready to begin getting feedback on that plan from our community.
Well, let's think about first, when we talk about a comprehensive plan, this is not something that is a one-off. The county, this is something that's required of all 100 counties in the state of North Carolina. We know that North Carolina is a rapidly growing state. There's just so much here to draw people from industry to our beautiful landscapes. And you all, this is part of your regular scope of work. This is not a new initiative.
Yes, so our Department of Planning and Development, we have two main functions. The first, often people see us frequently, is inspecting structures and making sure things are built properly. But the other part is planning ahead. We want to be proactive and not just reactive. So our county right now is home to 204,000 neighbors.
Right.
And by the year 2050, we're going to have an additional 70,000 new community members, according to the state. So we want to be proactive in setting up the county for success to be able to handle that growth, and as well as preserve our coastal natural environments, our rural heritage, and really make sure that as we grow, we also keep who we are.
So it's this first defining the identity of Onslow County, who we are historically, who we are naturally. What is it that makes Onslow County the distinct and wonderful place that it is to live? What's attracting all those awesome neighbors?
Yes.
And really defining that, and then how does that go forward?
Yes. So the plan has really three main parts to it. The first is existing conditions, which is exactly what you're saying. It looks at who we are as a county. And we spend over 100 pages looking at that in depth and across a wide breadth of different categories. Then we transition to looking at the vision and where do we want to be as a county. And through that, we establish goals, objectives, and strategies. And that's what guides the work that we do towards preparing the county for the future.
Very good.
Then we establish a future land use map, which shows us visually how's the county to be laid out. And as folks come here to develop, where should that be and what should that look like?
Now, you and I had a conversation several months ago, just one-on-one conversation about that, about the look of Onslow County and really celebrating that identity about, where can growth happen. And you talked about some really wonderful ways in which you all build relationships with developers. Talk a little bit about that, because your input and their vision and the needs of the community all coalesce, right?
Absolutely. So the plan's goal is to guide developers as they come into the county. So the county necessarily isn't going out there and building projects, but the guide is really there for developers when they want to come here and are selecting their next project site. They can look at the map and see what is our vision as a community, how to develop, come alongside that. And as they build infrastructure, it's supporting different projects and plans that we have or our external partners have. So that way, as we build up our community together.
And you say together because your exterior partners are certainly first and foremost our citizens.
Yes.
But you also work with other agencies and organizations that serve our community as well. Talk a little bit about how important they were to the earliest of conversations.
Yes. So when we've hired a consultant to help us with this process, and we made sure that they sat down and met with all of our different stakeholders, such as the Department of Transportation, and we've had conversations with the school system, we've had conversations with our utility providers, and really to make sure that they were there from the very beginning. And one of my favorite strategies in the comprehensive plan is that it's going to guide us to continue to work with the Jacksonville Urban Metropolitan Planning Organization, NCDOT, the school system, ONWASA, to make sure that we're all advancing the county together across all of our different needs as a county.
Now, and the idea too is that this is a long-term roadmap for all of us.
Yes.
For each of our agencies, our departments, for citizens making decisions about where they might want to build a home. I mean, these stakeholders all have a voice in this project, and you're giving us a second opportunity to have some insight and input and provide you with feedback.
Absolutely. So during the whole month of April is going to be the opportunity for individuals and citizens to provide us feedback. So we're going to do 3 physical meetings the very end of April, April 22nd, 23rd, and 24th, where each night we're going to go to a different place in the county for citizens to come talk to us and take a look at the plan and ask us questions and provide their comments. So we'll be down in Sneads Ferry on the 22nd. 23rd, we'll be out in the Swansboro, Hubert, White Oak area. And then on the 24th, we'll be up in Richlands.
Very good.
And then the whole time, you can access our website and provide a feedback there. So you can do it at your convenience. We're going to do a series of videos for individuals to watch and learn more about the plan, as well as you can always email or contact our planning department.
And this, Carter, which I've been so impressed by, is also how dynamic this is. You're not saying that this is what we're going to do. This is a fluid opportunity to grow our county wisely and efficiently, and yet remain true to who we are, which is attracting all those folks to this space.
Absolutely. And during this whole time as well, we're going to take that feedback. We're going to look at it over this summer and make the changes that we need to make before we go through any sort of public adoption process.
Fantastic. Carter, is there anything else you'd share with our viewers about why Horizon 2040 is important, not just to the county and in terms of the county government, but to them?
Absolutely. This is how we're charting the course for our future, not just as a community, but our home. Everyone deeply cares about their home and is special to them. Some folks have been with us for a short period of time, some it goes back generations. And so I think we all care about our home, and this is our chance to shape our home's future. And it's not regulatory. It's not providing any sort of requirements on the individual's properties, but it's a guide. And so this is people's chance to provide input before we do the next plan. But this plan as well will be updated, maintained, and executed. And so this is a great time for people to engage, learn more about this process and about the future of Onslow County.
Well, we appreciate it. We appreciate all the effort, all the compassion and heart that has gone into this, and all of the logistics and data. I mean, it is all of those things in one, and we are looking forward to learning more.
Absolutely. We're excited to share more and share our hard work because everyone on our staff are your fellow citizens, so we care. And so we're putting very much our heart and souls into it to make sure it's the best thing that we can put forward for Onslow County. Well, thank you, Carter, and thank you to your team and all of their efforts. Thank you so much. Thank you for having us here, and we're glad to be here. Thank you to each of our guests for joining us today, and a very special thank you to you, our viewers, for learning more about how Onslow County and our wonderful employees work on your behalf. This month is a great time to find out more. We invite you to visit our websites, learn more about how our institutions and organizations and agencies all work to bring Onslow County forward together. Thank you as always, and we'll see you next month.